How's everyone doing? Let's get right to it. Quetiapine, Seroquel. What is it they're not telling you about this drug? What they're telling you about this drug, it is a drug indicated for the treatment of schizophrenia, bipolar disorder, depressed, and manic. Schizophrenia is a disorder of disorganized behavior, speech, hallucinations, delusions. Bipolar is the pole, the depressed and the manic. The manic is the agitated, racy state. The depressed state, we know what depression is, mostly. It's indicated for those two things. It has off-label uses. What are its off-label uses? Which are abundant. Anxiety, 25 milligrams 3 times a day, treats anxiety. Depression, 50 milligrams, 100 milligrams at night for depression. Insomnia, it works for insomnia. What else does it do? It can be used in drug withdrawal. I've used it in heavier doses to stop the withdrawal from opiates, benzodiazepines, barbiturates, and alcohol. It can be an adjunct in drug withdrawal. So those are its on-label uses and its off-label uses. Now, to be fair, after years of working in treatment centers, this drug has illegal uses. It's called Suzie Q or Q-ball or Seroquel, and it's used to induce a state of sedation. Mixed with other drugs can have a synergistic effect on sleep. How does this drug work? Interesting. I like this drug, and this is the reason I like Quetiapine, which is the chemical name, trade name, Seroquel. This drug has antidepressant effects and anti-anxiety effects because, like Buspar, like Gipirone, like Vilazodone, which is Vibrad, which is an antidepressant, it stimulates agonist at the 5-HT1A receptor. That's unique in the atypical antipsychotic list of drugs. Another one that does it is Abilify, Piprazole. That's why it has so many advantages in the treatment of anxiety and depression. There's another unique quality to this drug. It blocks the H1 receptor, the histamine receptor, in the central nervous system. If you block the histamine receptor, you get sleep. You also get increased appetite and possibly weight gain, but it stimulates that receptor. Now, in opposition to that, a drug which stimulates histamine, which is an aside here, is modafinil, Provigil, or Nuvigil, or modafinil. It releases histamine, giving the user or the person who takes that drug an energized, more focused, more alert state. I think it's a great drug. It also causes a combination of an antagonist effect at the 5-HT2A receptor and the dopamine receptor. With its dopamine antagonism, it's transient, meaning unlike the other atypicals or typical antipsychotics, Rexulti, Risperdal, Zyprexa, Haldol, Mellaril, all those older drugs, newer and older drugs, they permanently block that D2 receptor. And when you do that, you get a lot of muscular side effects, restlessness, twitching, muscle spasms, higher risks of getting a permanent tic called tardive dyskinesia, or a side effect called akathisia, where you have to constantly be in motion, or dystonias, where your muscles cramp and bend and you get all spasmatic. Those are all the extrapyramidal side effects associated with drugs that permanently antagonize that D2 receptor. Oh no, not Seroquel. It's transient. It comes on and off. Same with its 5-HT2A. It comes on and off. So it doesn't have all those horrible side effects. Another one of those D2 side effects in a certain pathway called the tubuloinfundibular pathway causes effects on prolactin which increase it and makes women secrete breast milk, which is very unpleasant. It does not do that. So we're not doing all the disfiguring side effects of the other antipsychotics like breast milk production, tics, muscle spasms. It has a much lower risk of the permanent disfiguring tic called tardive dyskinesia, the temporary muscle spasms, and muscular movements and akathisia, restlessness associated with the other antipsychotics. So this is great. The benefits of the antipsychotic without a lot of the negative side effects. This is my drug of choice. We have to remember it's not for everyone. Older patients with dementia, this drug could be potentially very harmful. It has black box warning. It also, like all known antidepressants, because of that 5-HT1A stimulating property, has a risk of suicidality in young individuals and adolescents. So you need to keep that in mind. What are the main side effects? It has something else where it blocks this alpha-1, which is sympathomimetics, the norepinephrine system that helps the cardiovascular system raise blood pressure upon standing, and then you could get lightheaded, orthostatic hypotension. It's a possible side effect. So dizziness, lightheadedness can cause drowsiness. Well, you can take advantage of that. It can raise blood glucose levels. I haven't seen much of a problem with this. Nothing like Zyprexa, olanzapine, which is the worst. This one is probably one of the best of the antipsychotic realm, but it can raise cholesterol, raise triglycerides, raise glucose, cause glucose intolerance, predisposed to diabetes. It's rare. I've yet to see it. May put on some weight. Those are the big side effects of quetiapine. But if you're going to pick an atypical or you need an antipsychotic, this is a good choice. So where this drug, in my mind, comes into play is if you're on an antidepressant and you have a partial response, add Seroquel, quetiapine at 50 to 100 milligrams. Bipolar patients, you can give 200 to 400 milligrams. Treats bipolar, helps them sleep. It's a game changer. And I don't see a lot of weight gain. I don't see a lot of side effects. So it can help dramatically. And in psychosis, I've used it 400 to 600 milligrams a day. They make an XL formulation, so you can give it once a day. If you're using the immediate release, you have to give it twice a day because it only lasts in your system, has a half-life. Half the drug is metabolized in 7 hours. So it's a rather short-acting drug. So keep that in mind. And I've used it giving patients 25 to 53 times a day in drug withdrawal. So it's a very safe drug. I've never had a successful overdose. I've never seen anyone have any negative consequences from an overdose. It's not even a worry. I rarely see side effects. I have to say, among the antitypical drugs, this one I probably use more than the others, but I use a lot of Abilify. And yes, I have used a lot of the other ones. Everyone has their niche, but this one's niche is bigger than the other ones. Just because you're on another one doesn't mean it's a mistake. Each one is beneficial in its own niche. Thank you, Dr. Mark Agresti.